The other thing is out there on social media, and
Hmm.
if you're thinking about plastic surgery, one thing you'll run into a lot is people talking about lymphatic drainage. So
Hmm.
that kind of is a good segue to you're talking about that lymph system, and you're trying to get things maybe moving again. And do you recommend for your patients lymphatic drainage before or after or both?
Lymphatic drainage helps a lot. And one of the things that if you tell a patient that they're going to get a massage after an abdominoplasty, the eyes will go like wide open and say like, "Oh my God," because what they're imagining is like a Swedish deep
Hmm.
tissue massage for relaxation. But in reality, lymphatic drainage is very, very superficial. The lymphatic system is localized in the subcutaneous tissue, so just below the skin. So you do not need to go that deep. So for that reason, it's not very painful, and always like around a week after surgery. Some people like to start at 3 to 4 days after. It can definitely help. Then, as you know, we provide for our patients compression garments or different garments or different bras and different things that we think that are the best for their post-operative period, for certain areas to be compressed. Sometimes, for instance, if we do liposuction to the legs, we want to start compressing at the level of the ankles, for instance, or and compress from the abdomen to the ankles, even if we were just doing liposuction to the legs. But that is the way to compress that area in a much, much nicer, more uniform way. Then you start to face other things that we know as civilians, and that say like, "Oh, I got some swelling, let me put some ice." Mm, not good.
No,
Not good.
not.
Right? Because we that one we always have it, right? We know that, oh, yeah, I got some trauma in my elbow. I got a big hit. Give me a bag of ice and I'll put it there to decrease the inflammation. It works. It's very effective. It's really good. But here are some of the reasons why we don't want to use it. So remember that in plastic surgery, we're always stretching, we're always pulling, we're always making things tighter. We are generating pressure. Pressure and blood flow. I'm putting some pressure here for our audience that can see our podcast. I'm putting some pressure, and you can see that my blood flow to my hand when I put some pressure, it's not great. It kind of starts going, it blanches, it goes white.
Hmm.
So if you add ice to an area that already has some pressure or tension, then you're going to decrease the blood flow to that area. So even though it's fantastic to get to try to decrease the amount of volume, amount of fluid, the amount of blood that you have in that area, but for blood perfusion, for keeping the tissue alive, it's really bad. So every time that we're doing a breast lift, every time that we're doing a facelift, all that tissue, what we want is to be well perfused. So we don't want any ice shutting down the small vessels and then killing that tissue, because the tissue can die. The skin can
Ah.
turn black and then sloughs off, and then you don't have skin in that area. The other thing is that, as we all know, extreme temperature, either hot or cold, can burn your skin. Right? You can get a bad burn from having or holding ice in a certain area. But what tells you that it's creating or causing some damage is that it hurts. But
Mm.
after surgery, your sensation has changed, at least temporarily. So you have quote unquote superpowers. You might not feel pain in that area, but at the same time, then you don't have that protection, the natural protection. And then if you just leave a bag of ice for 20, 30, 40 minutes in the same area, that can cause a bad burn to the skin in that area. And then the same thing, skin dies.
Mhm.
So those are the reasons why I would say applying ice. I mean, unless it was fully indicated by the surgeon and very specifically directed, it's not a good idea. Ice doesn't go very well with post operative plastic surgery.